Mental Health First Aid. My name is Denise Ellsbury. Today we are joined by Dr. Nadjeh Awadallah. Actually, Nadj works with me in my office, so I'm excited to have him here today. He's going to tell us what he does and the connection between Northwest Community Hospital and Linden Oaks. So welcome, Nadj.
Thank you for having me, Denise.
So tell us, what is it that you do in the marketing office?
I work for behavioral health outreach. So shortly after I started with Linden Oaks, I was sent up to Northwest Community Hospital because Linden Oaks has a management agreement with that hospital to oversee the behavioral health service lines that they have there.
Okay.
So one of my jobs is to make connection with professionals in the industry, other clinicians, primary care physicians, schools, and coordinate with them to connect students, patients, prospective patients with behavioral health services at NCH.
So you're out and about a lot.
Yeah, there's a lot of field work. There's a lot of going out and giving a presentation about our comprehensive service lines, and also talking about, through the partnership, what additional services we bring to the northwest suburbs as being a partner with NCH now.
Okay. So you mentioned a management agreement for the behavioral health part of Northwest Community Hospital, which is located up in Arlington Heights?
That's correct. Yeah.
Okay.
Since October of 2014, Linden Oaks was brought in, the management team was brought in to help kind of make some changes to like programmatic changes, what levels of care they offer, fundamental changes to the therapy provision in the hospital, and then also through marketing, through kind of making the community aware of what we have to offer in that area.
Okay. So currently what programs are up at NCH? Short for Northwest Community Hospital, right?
NCH currently has inpatient behavioral health for adults. They're also running an inpatient behavioral health and a inpatient dual program for adolescents. So that would be behavioral health as a primary diagnosis, substance abuse as a secondary diagnosis.
Because sometimes people have disorders or concerns related to both of those things.
Yeah, I usually say there's like a chicken and egg relationship between substance use disorder and behavioral health. A lot of times you don't know if somebody began self-medicating to cope with symptoms related to behavioral health reasons, or if somebody was using substances in excess and that created some behavioral health symptomology for them. So
okay.
With adolescents, we treat them inpatient for dual, and we also have an intensive outpatient and a partial hospitalization program for them. The partial hospitalization program is a day treatment program. They're there for treatment the entire day and they go home in the evening. The intensive outpatient program is a half day. They come in at 7:30 in the morning and then they leave by 11 o'clock and then go to school for the rest of the day after that.
So the benefit to that intensive outpatient is that people can start to kind of get back into their normal or regular routine. School isn't disrupted as much, things like that.
Yeah, they can be directly admitted into the program, but what's typical is you see it as like kind of a transitional step down. Somebody might be admitted into the inpatient unit, step down to partial, then step down to IOP before not being serviced at the hospital at all.
Okay, all right. So currently those are the programs that are going on, adult, inpatient, and then those different levels of care for adolescents.
Mm-hmm.
Any services for, when you say adolescents, are we talking like 12 to 18
Yes,
year olds?
we are talking 12 to 18.
So any services for children or?
We do not have any pediatric service lines up there. We do have some strategic partners in the industry that we work with in that area to help service pediatric.
Okay.
But right now it's age 12 and up at NCH.
Okay, all right. And anything in the works at NCH? Or?
Yeah, actually since our partnership with them, we've built a number of programmatic expansions for them. So we're going to be adding 50 beds in the next couple of months. 20 of those beds are going to be allocated to a geriatric unit, which will be more considered a kind of a generations unit. It'll be age 50 and up likely.
Because sometimes the issues are different for 50-year-olds and older than sort of a younger adult population?
There might be different mitigating factors to what's going on, but also programming with people who are in your peer group age-wise is something that's conducive for group therapy. So
sure.
Separating it out by age that way is something that's usually favorable in therapy.
Okay.
So we're going to be adding those. We're also going to be adding a CD residential services in the mid-year, hopefully in 2016, to service adults.
So what does that mean, CD residential?
It's going to be a chemical dependency program, which is 30 days. Someone would be admitted to address substance use disorder. They'll also at the same time have oversight from a psychiatrist and behavioral therapist. So if they have some comorbidity going on where they also have behavioral health diagnoses, those could be addressed as well.
Okay. Typically when people are inpatient, it's a much shorter period of time.
If you're on a traditional acute care inpatient unit, it's really kind of specific to what the circumstances are at admit. But it's a residential facility is one that tends to be more towards a month. If you're going to be in inpatient, the goal is to stabilize you behaviorally for step down. It's not intended to go be checked into a psych floor and then stay there for a month.
So that 30-day residential is significantly longer than most people are staying inpatient. Okay. All right.
And we are going to be expanding services as well to include intensive outpatient, partial hospitalization service lines for adults as well.
Okay, so they have that step down.
So they will,
option
they will
as
soon
well.
also have the step down option. Yes.
Okay, all right. So if people are wanting to find out about or feel that they need to access the behavioral health services up at NCH, how do they do that?
Yeah, there's a couple of things that we've done new since we've been there. Prior to Linden Oaks being up at NCH, the only way into behavioral health services at that hospital was to go through the emergency department, which isn't always the best entry point, especially if somebody isn't experiencing an emergent behavioral health situation.
You're almost saying it has to be really bad before
right.
you can.
One thing that people can do now is we have a dedicated 24-hour call center, and the phone number for that is 847-HEALING.
Okay.
And someone can call in to make a referral, or the prospective patient themselves can call in. They have ability to field the call in any language that's available because it has translation service as a component of it. But when somebody calls there, they would get a cursory screening over the phone with a master's level clinician, and that clinician would then review content of what they gave on the call with an on-call psychiatrist and make a recommendation. From that point, they would schedule them for a face-to-face screening. Another thing that was new since us being up there is that the screenings are free. Prior to that, they just had the emergency department experience, which you obviously got a bill for, and that wasn't favorable for a lot of reasons. We have the ability to schedule a 45-minute to an hour face-to-face full psychological screening at NCH or any other location in the Linden Oaks network of hospitals.
Okay.
And then we have reciprocity, so you can be treated at any location regardless of where you have the screening done.
Okay.
And a lot of those can be scheduled same day. So if a school calls, for example, recently we had an issue with the middle school system in the northwest suburbs doing a signs of suicide program. And they were sending a bunch of kids to the emergency department based on report that they've had thoughts of suicide or thought to harm themselves in the last year. Not all necessarily having things that were emergent and right now. And so one of the things I did is I had to go speak to people in the school system to explain that you can go this route. There would be no cost to the parent. They wouldn't get a charge for being evaluated in the ED and get scheduled a same-day appointment for the evaluation in the department, in the psych department.
So it works way more effectively for families in terms of cost and time and everything, and much better ability to assess sort of the level of care that's appropriate for
Plus,
that
it's
person.
it's not as turbulent of an environment as the ED is, which might be very activating and might affect the presented symptoms at the time of assessment too.
Right.
You know.
So when we come back, I want to hear about a new program that you've developed in the last couple of months. I'm really excited about that program. So join us after the break to hear about the Rethink program for adolescents.
Tú no eres un superhéroe. Visita al doctor regularmente aun cuando te sientes bien. Así podrás seguir cuidando a los que sí te ven como un superhéroe. Para más información, visita ahrq.gov.
Whatever we deny or embrace, for worse or for better, Underneath everything we are, underneath everything we do, we are all people, connected, interdependent, united. And when we reach out a hand to one, we can influence the condition of all. That's what it means to live united.
Welcome back to Mental Health First Aid. We've been chatting with Dr. Nadjeh Awadallah, who works at Linden Oaks with me in the marketing office, but specifically works up at the Northwest Community Hospital area. When we left for break, I mentioned this Rethink program, which is something that you put together and you've developed. So tell us about this Rethink program, Nadj.
Okay, well, the Rethink program is really a resource for schools. I'm working with schools in Consolidated School District 15, Consolidated School District 59, and then School District 214 and School District 211 up there.
It's kind of like Arlington Heights,
Schaumburg area, yes.
Okay.
Yeah, and we're in our pilot phase of the program just for the first year. I'd done kind of like a meeting with a lot of representation from the school to see what they were looking for to help them in kind of addressing students, like kind of behavioral health, substance abuse, and use concerns in schools. One of the things that we had talked about were suspensions related to substance abuse, people being found to have possession of substances on campus, using it on campus, kids being ticketed for being at a party, and then having repercussions at school for that. So in talking with them, it looked like they...
And typically what happens with that is that if a kid gets caught with that, then they're suspended out of school for 3 days, 5 days, 10 days kind of a thing?
The maximum I've seen is 10 days. It's
Okay.
usually a 5 to 10 day suspension. And in those school districts, there's separate punishment. So let's say they're a student athlete, they would get a punishment from the disciplinarian at the school. They would also get a punishment from the medical director. So that's 2 separate punishments. So they were looking for some resources to use in kind of addressing the suspension. So I came up with the Rethink program, and it can be used by schools as either an alternative to a suspension, so they would forego suspension altogether if the student participates, or like a reduction to it. So they might
Okay.
reduce a 10-day to a 5-day, or like a 3-day suspension to a 2 or 1 day suspension based on whether or not they participate.
Because it doesn't really help the kid in any way to be out of school for 5 to 10 days.
Yeah, and some of the schools do an in-school suspension, and some of the school social workers, for example, told me, well, we put them in a room with a proctor and ultimately end up sleeping in the room for the day. So I went through and I tried to look at what are some things that we can do psychoeducationally. So the Rethink program workbook that I developed was about 15 exercises that are founded in cognitive behavioral therapy. So
Can you give us like a 2-sentence synopsis of cognitive behavioral therapy?
Okay, CBT was founded by Aaron Beck, and it's a treatment modality that looks at how thoughts are connected to emotions and connected to behaviors and actions. So the idea is if you change the thought, then you can stop the cycle of leading to unwanted emotion and unwanted behavior.
Because sometimes what's happening is people don't have any insight or don't make the connection between the thought that they're having and how that's impacting their mood or then their behavior.
Yeah.
Okay.
Right.
So
Yeah.
trying to bring awareness to those connections.
Yeah, people get in behavioral cycles, a lot of times unhealthy ones. So looking at the thought that's kind of setting that all in motion and changing it is like a really efficient way of changing unwanted behavior.
Okay.
So
I brought
used-
your workbook
Oh,
here
yep.
if you want to.
Yeah, thanks. So I used exercises that are related to SAMHSA's curriculum because I also use like a CBT framework.
And SAMHSA is the Substance Abuse Mental Health Services Administration,
That's
correct?
the-
It's a federal government organization.
Exactly right. And they use all validity tested exercises that are related to CBT and cognitive changing, cognitive restructuring.
Okay.
So I adapted some exercises from them, and I also adapted a lot of exercises in here from the ones that are already used in our programming. So if a student does get referred for the Rethink program and it looks like they need some higher level of care, there's continuity. They'll recognize some of the exercises that they've done in this program to match
Okay.
some of the things that they already do in the IOP program,
Okay.
some of the things they already do in the PHP program.
All right.
And one thing that's kind of innovative about it is that it has 3 parts to it. There are some other alternative suspension programs out there, but typically what they are is just like a lecture that is attended by the student, and then the school ultimately just gets an attendance sheet saying that they were there and they met their obligation.
And we know how much teens like lectures.
Yeah.
Right?
So this program actually has a couple of parts to it. The first one is an independent learning, like online class, which they would have 3 days to a week to complete, depending on when they call and register.
And so what's that online class look like?
Well, they'll log in, they'll have access to the workbook. They can download the workbook, or they can pick one up at NCH. It's expected that they'll complete this in the time that they're doing the online class and bring it with them to their on-ground session. And there's 3 videos that they'll access online. They're animated, and they take a character through a couple of vignettes where you look at him using CBT to help himself through problems with his friends. They talk about thought stopping. They talk about like refusal techniques. Like there's a scene where multiple friends try to offer him substances or encourage him to use substances in a way that he can get out of that's like socially appropriate, socially acceptable. So it looks at refusal strategies.
Okay.
And there's humor in the video too, so it's something, and the kids that we have done the program already liked it.
Sure.
And the video takes them through each of the exercises in the book.
Okay.
And so they'll complete that. They'll bring that in to NCH for a scheduled on-ground psycho-ed class. And we hold those Tuesday evenings.
Okay.
Every Tuesday. We do have the ability to make an accommodation for Saturday morning if need be, because we require a parent to attend with them too.
So that's an opportunity for the parent and the kid to gather some information and have further understanding about sort of the CBT techniques or process or understanding.
Well, and the lecture on ground is geared towards the parent as well, and warning signs, things to look for.
Okay.
For like.
Do you have parents and kids together, or are they separate? Okay.
In the same class together.
Okay.
Excuse me. So they'll come to an on-ground session, which is an hour. They'll be facilitated by a master's level clinician, and then they would take a quiz at the end of the class.
Okay.
Once they've completed that, there's one last step. And the last step is an online kind of rethink addiction awareness screening.
Okay.
And it'll ask questions about the students' thoughts about substance use, their substance use behavior, things like that. Using that survey generates a report. If they answer the questions in a way that shows that they still have some risky thoughts or behaviors, it'll ask if they have permission to be contacted by our 847 healing staff. We'll call them and talk to them, or based on your results, it looks like it might be a good idea for you to have a full screening done for one of our programs. And then that's their choice at that time. So
it's not mandated that they have to go in for additional treatment or something, but at least it's making people aware that there might be some additional concerns.
Yeah, and we've piloted this at NCH as well as Elmhurst. And in that time, we've had some good feedback. There have been a number of students who actually came through and were recommended for the full screen because we found there were some behavioral health things going on.
Like you were saying earlier, kind of like the chicken and the egg thing. You don't know, if the substance use was, attempting to cover up or address some behavioral health symptoms, or if it was the other way around.
Right. We've had some students come in for the program, go through, and then report in our session with their parent that they had some unsafe thoughts. And this is the first the parents are being made aware of these thoughts that their kid's having, and we're able to connect them with a screening right there.
So an awesome opportunity to really assess on multiple levels there.
Yeah.
So love hearing about that program. I'm really excited to see where that goes, and I hope that Linden Oaks is able to use that at all of our different campuses. So when we come back, we're going to hear about yet another role that Nadjeh plays at Linden Oaks. So join us after the break.
No, what'd she say?
She said whatever.
No, she says that all the time.
What's that?
Hello? I'm on the phone.
Mom, I'm on the phone!
Hello? I'm on the phone.
Who's this? It's me. I'm on the phone. Mom.
Oh, you're on the phone. All right.
Sorry.
Sorry. Anyway.
Who are you talking to? Kelly?
Mom.
All right.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who would love to put up with you.
Ready. Ready. Ready.
It can be a little awkward when your friend tells you he's been diagnosed with a mental illness. But what's even more awkward is, if you're not there for him, he's less likely to recover.
I'm here to help, man, whatever it takes.
Welcome back to Mental Health First Aid. We've been talking with Dr. Nadjeh Awadallah, who works at Linden Oaks and has where you wear a bunch of different hats. Let's just put it out there. So we were talking about Rethink and that program, and that you really developed that program. I know you spent a bunch of time over the past, I don't know, 4 or 5 months crafting the video part of it, as well as putting together the workbook. So it's been fun to watch that program come to life there. So
Yeah.
But another hat that you wear is with the Linden Oaks Medical Group. So I know you also provide some individual counseling as yet another level of care throughout the system, correct? So tell us about that, because that's been a relatively new development at Linden Oaks.
Right. Well, the Linden Oaks Medical Group was it was just comprised of like psychiatrists who were doing med management after patients were being stepped out of our IOP program or being discharged from actually any of our levels of care.
So so the psychiatrists would really just meet with people to make sure that their medication was doing what it was supposed to do, kind of a thing, and that was really it. They weren't doing any sort of ongoing counseling or anything like that. Okay.
Yeah, so as of September of this year, they actually expanded the services to include therapy.
Okay.
And so since September, I've been seeing patients at the LOMG office on Mill Street in the evenings.
Okay.
And I've been, it's something that I think has been beneficial to patients who are being stepped down and discharged from our staff, because it kind of like adds like the final chain and like the full continuum of care. Most of the patients that are seen by therapists at LOMG had previously been in programming at some other level of care in Linden Oaks.
So they might have gone from inpatient to that partial hospitalization to the intensive outpatient, and now weekly counseling? Is that typically what it is?
Well, it's not necessarily all of the levels. Sometimes
Okay.
somebody will be, inpatient, stabilized, not necessarily need to be stepped down to one of the other ones and might come directly to this.
Okay.
Or they can have directed met to the PHP or IOP also.
Some people just start at that
yeah.
level, like partial or intensive outpatient. Okay.
Yep, but they, once they are discharged from any level of care and they're looking for outpatient therapy, so they're going to have med management or outpatient therapy, it's good to have like internal practitioners to do that, because they'll have, all working off of the same med record,
Sure.
all of them working out of the same, out of EPIC, the system where we keep track of the patient's progress through the program. And, it's also good because, they're used to the environment, they're used to being on campus. If they're in the PHP and IOP program, they're already going to have been at the Mill Street location.
Right.
So it's had really positive reaction from the clients that I've seen in there.
Nice.
To have this additional level of care. Previously, we'd had to refer out to other private practices for the therapy. And really, it's advisable to have like a multi-pronged approach to treating your disorder after being discharged, not just taking the medication, but also learning what you can do yourself in shaping your own behavior and thinking to kind of like maintain a healthy lifestyle.
Sure. So what kinds of things might you be working on with a client in the weekly counseling sessions?
I do integrative therapy, so it really depends on what's best for the client. I found a lot of clients actually looking for DBT or ACT or CBT, things that they've already done in our care in the IOP and PHP
Can you
program.
tell us what, we heard about CBT, but what's DBT and ACT?
Oh, dialectical behavioral therapy or acceptance commitment therapy are things that they would have seen when they were in one of the other levels of care.
Okay.
And they're like, oh, this really worked well for me.
Okay.
I would like to continue with this, moving forward. And so we can structure therapy to look like that and continue with the treatment plan that they've extended from being inpatient or they hadn't established and establishing a new one.
Okay.
And, setting small measurable goals for them and looking, in small chunks, what they can do, what they can modify to like address those goals, meet those goals.
So again, kind of continuing that same idea of helping people bring awareness to thoughts and the connection to feelings or mood and then behavior.
Yeah, no, a lot of times people talk about addressing behavioral health, substance use, disorders as being kind of a lifestyle change. Just like you're going to make the commitment to eat healthier the rest of your life, you can make the similar commitment to be healthier mentally. Handle your emotions in a healthier way.
Can you give
not
us
being as reaction.
Can you give us an example of maybe something that somebody might do to handle their emotions in a healthier way?
Okay, well, I mean, classical, like, non-healthy way to use it is self-medicating.
Okay.
Somebody might be dealing with anxiety and not knowing how to handle themselves in an anxious, like a social phobia type situation, so they'll use alcohol excessively so they can have some liquid courage or some way to handle like the overstimulation of the environment through using some substance. Working on strategies to kind of ground yourself and deal with the anxiety, quell the anxiety symptoms while you're in there so you can have more focus.
Okay, so instead of sort of like masking those symptoms with a substance, making some other like positive choices about things you might be able to say to yourself, or even behaviors that you could do that would be soothing in a positive way.
Right, or even something as simple as like respiration control, controlled breathing, something you could secretly do in any place, to kind of calm yourself down, kind of address the growing like anxiety symptoms, the physical anxiety symptoms you might experience, so you can handle yourself in a workplace situation or in a social situation.
Sure, and it's like people are typically in a partial program or an intensive outpatient program for 2 weeks, 3 weeks, maybe?
That's a pretty good average. Again, it's depends on how severe the symptoms are and things, but that's about right.
So when you think about having to learn some new skills, whether that's like practicing sort of that relaxation breathing kind of thing, it's all about practice, right? And so the opportunity for you to be able to continue working with people in an ongoing way once they're not in the hospital kind of thing at any level of care is really helpful, because people need to continue to practice those skills.
Well, and if you think about it, a lot of times the triggers or the things that are kind of exacerbating their situation are part of their home life or part of their work life. So let's say they're at the hospital and they're inpatient, then they leave, they're going to have to face that again. And they might need some guidance, they might need some coaching, some assessment while they're going through that. There's a new variable, there's something new I need help figuring out. And seeing a therapist on a kind of semi-regular basis could help them to work through those problems. We're really just looking to support the client in tackling these problems themselves. They're not coming in, we're just telling them what to do.
Right.
It's working on a plan that's feasible for them. That's it's highly collaborative.
Great. So what are there, like about 10 therapists, 12 therapists in LOMG now?
Yeah, I think we have 10 therapists in LOMG right now.
Okay, and just
but
typically,
our staff is growing.
Is it about like, do you work with people for a couple of months or?
For as long as the client really needs it. If somebody steps down, they might come see a therapist. They might go 6 weeks seeing on a weekly basis. Then we try for the next 6 weeks, twice a month, and then move it down to monthly. It's the same thing. It's at the client's pace. So it's just looking at transitioning them to being able to handle things completely independently.
Great. Well, I think it's a great addition to the level of care that's already offered throughout the Linden Oaks system. So great to hear about that, and also great to hear about all the different things that you've been doing, Nadjeh, at all levels of and all different kind of places within the hospital. So thank you for being with us today and sharing those things with us. Thank you for joining us at Mental Health First Aid, and until the next time, be well.